of hepatic focal lesions. Characterization and management of hepatic focal lesion is a commonly encountered problem in radiological practice. Imaging findings are diagnostic after additional consideration of clinical and biochemical evidence. Ultrasound and the Doppler are the commonest screening tool to detect hepatic focal lesions. Contrast-enhanced CT and the dynamic MRI are used to characterize the lesions and a narrow differential spectrum. Biopsy and histopathological assessment are rarely needed. Spectrum of benign hepatic focal lesions include hemangioma, focal nodular hyperplasia, adenoma, cyst, abscess, regenerative nodules, focal fatty infiltration/sparing, confluent hepatic fibrosis, biliary hamartomas, Caroli disease. Malignant hepatic focal lesions include hepatocellular carcinoma, metastatic disease, hepatoblastoma, cholangiocarcinoma, cystadenocarcinoma, hemangioendothelioma. Lesion characterization include size. Most incidental liver lesions less than 1 centimeter are benign. Number, attenuation, and signal intensity. Margin, benign lesions typically have smooth margins, enhancement pattern. Benign lesions include hemangioma, in ultrasound mostly well-demarcated homogeneous hyperechoic, except in fatty liver may appear hypoechoic. In contrast, enhanced CT appear on non-contrast base, appear hypodense lesion, showing peripheral nodular enhancement in arterial phase with centripetal filling in delayed phases. Enhanced MRI showing well-demarcated lesion with low T1, high T2 signal, and peripheral discontinuous nodular enhancement, progressive centripetal enhancement in delayed phases. Focal nodular hyperplasia, variable appearance, may be homogeneous, hyper or hypoechoic, showing central hyperechoic scarring, hypodense on CT, and with central scarring showing delayed enhancement. ISO في T1 in MRI scan, and high في T2 appear central scarring showing delayed enhancement. Hepatocellular adenoma, heterogeneous hyperechoic in ultrasound, typically well demarcated in CT, showing peripheral enhancement during early phases with centripetal flow during portal venous phase. Liability to recent hemorrhage are high in hepatic adenoma. Typically in MRI, it is a well demarcated lesion with arterial enhancement and subsequent phases showing centripetal filling. Typical hemangioma showing peripheral nodular enhancement. A typical hemangioma like giant hemangioma, flash filling hemangioma, slow filled hemangioma, calcified hemangioma, hyalinized hemangioma. Other unusual hemangioma with capsular retraction, hemangioma with surrounding nodular hyperplasia, hemangioma with fatty infiltration, pedunculated hemangioma, cystic hemangiomas, fluid level containing hepatic hemangioma. Here, ultrasound showing hyperechoic well-defined lesions in right posterior loop, and a non-contrast based CT showing hypodense lesion with peripheral arterial enhancement and centripetal filling in delayed phases. Another case of hepatic hemangioma, an MRI showing pre-contrast T1, low T1 and a high T2 signal, and peripheral nodular enhancement at arterial phase, and wash out in delayed phases. Flash filled hemangioma, homogeneous enhancement on arterial phase. Large heterogeneous hemangioma with central fat content with peripheral nodular enhancement. Giant hemangioma in axial contrast enhanced CT arterial phase and coronal T2 MRI. Hyalinized hemangioma differs from typical hemangioma by containing extensive fibrous tissue and obliterated/thrombosed vascular veins. Focal nodular hyperplasia showing homogeneous avid post-contrast enhancement with central hypodense scarring that show enhancement at the delayed phase. Hepatic adenoma. Hepatic adenoma are hepatocytes separated by dilated vascular sinusoids, mostly in female reproductive age with high risk for oral contraceptive use. Hypervascular lesion with delayed contrast enhancement of the capsule. Very high liability for hemorrhage in hepatic adenomas. Fat-containing adenomas in and out phase MRI sequence showing suppression of the fat content at the out phase MRI sequence. Here is a case of focal fatty sparing in fatty liver. Focal fatty infiltration mostly take the medial segment of right loop. Focal hepatic confluent fibrosis. Most demarcating site is capsular retraction with non-hypovascular area at the periphery of the liver. Cystic liver disease includes simple cyst, traumatic cyst, pyeloma, Caroli disease, cystic Metz abscess, hydatid biliary cystadenoma. Here is a case of hydatid cyst in contrast enhanced CT and high T2 and the T2 axial T2 MRI. An ultrasound showing inner daughter cyst with water lily sign. Another case of hydatid cyst with inner daughter cystis and water lily sign. Hepatic abscess spread by bile duct, portal vein, hepatic artery, direct extension. Mostly well demarcated, associated with marginal enhancement and post-contrast styles and perilegional edema. Liver abscess, another case of liver abscess in liver with diverticulitis, posterior segment of the right loop with marginal enhancement. Caroli disease, multiple cystic areas with central dot sign caused by visualization of bright contrast enhanced dot surrounded with fluid density. The dot represents the intraluminal portal vein within the dilated biliary duct. Multiple biliary hamartomas in MRI. Malignant hepatic lesion, hepatocellular carcinoma, poorly defined margins with irregular internal echoes and ultrasound, and contrast enhanced CT hypervascular lesion showing early arterial enhancement with delayed washout, and MRI low T1, high T2 signal with the same pattern of enhancement. Cholangiocarcinoma may be hypoechoic in ultrasound, showing being hypodense in contrast enhanced CT and peripheral delayed rim enhancement. Low T1, high T2 MRI, dynamic images show peripheral rim enhancement followed by progressive concentric filling of the tumor with contrast materials. Liver Mets usually multiple lesions. Metastatic adenocarcinoma are hypoechoic in comparison to the surrounding liver parenchyma. Metastatic liver disease on CT, usually from the GIT colon, stomach, pancreas, are showing lower attenuation in contrast to the brighter liver parenchyma. Hypervascular Mets, mostly from neuroendocrine tumor, renal cell carcinoma, or thyroid, appear rapidly enhancing lesions on arterial phase. Here is a case of HCC, non-contrast base, being isodense to the liver parenchyma and showing early arterial enhancement with washout at the portal phase. Hypervascular Mets, above case showing infiltrative lesion with arterioportal enhancement. Lower case showing capsular early hypo and delayed enhancement in delayed phase portal phase. Here is a case of HCC with malignant portal vein thrombosis. The thrombus inside the right portal vein showing enhancement pattern similar to the hepatic focal lesion. Another case, MRI liver cirrhosis with HCC in non-contrast and early arterial uptake and washout at the portal phase and delayed phase. Fibrolamellar carcinoma, mostly in non-cirrhotic liver, younger patient, has central scar, maybe contain calcifications. The scarring showing early enhancement. Metastatic liver disease, either hypo or hypervascular lesions, hypo or hyperechoic ultrasound, cystic or calcified, according to the primary lesions, may show peripheral halo signs, may be infiltrative lesions, mostly multiple, including both loops. Here is an example of hypovascular Mets on the right side and cystic Mets on the left side. Cholangiocarcinoma, it's infiltrative lesion associated with capsular retraction, segmental biliary dilatation, delayed contrast enhancement, either peripheral or central involution. Here is associated with anterior segment of right loop with capsular retraction and being hypovascular associated with biliary dilatation. Hilar cholangiocarcinoma / Klatskin tumor, mostly including the hepatic duct, common hepatic duct, and rising to the right or left hepatic duct, associated with biliary obstruction. Biliary cystadenoma / cystadenocarcinoma, nodological base, it's difficult to differentiate. May containing septi, enhancing septi, or soft tissue component within the cyst in the liver. Hepatoblastoma, it's usually in a neonate, bear large lesion, hyperechoic in ultrasound, may contain calcification on contrast CT and showing heterogeneous enhancement with breaking down areas. Hepatic epithelioid hemangioendothelioma, it's a large aggressive infiltrative lesion involving here most of the liver, showing central necrosis and portal vein invasion. Thank you.